and welcome to Transcendental Transformation, the place where spirituality and transformation unite. Host Miss Raina imparts truth so that you can break through your limiting beliefs and evolve into a deeper consciousness. As you go about your day, remember, before every breakthrough, there is a breakdown. And now, let's start the show.
Good evening, everyone, and welcome to tonight's episode of Transcendental Transformation. I'm your host, Miss Raina, and today is Tuesday, October 6, 2020. As always, we are coming live from the Sirius Star System studios right here in Fort Lauderdale, Florida, and I hope all is well with everybody. So if you're wondering why I look so pretty today, yes, I got my makeup done and everything. It's because I was in Stuart, Florida today, and the reason why I was in Stuart was because there was a board meeting for the school system. And I guess apparently it was on the LGBTQ, and apparently the board was trying to adopt a proclamation to have the LGBTQ History Month and education for LGBTQ people. And the chapter that I help, PFLAG of Stuart, which is run by Barb and Gary Silver, wonderful people, by the way, they asked me to sit in for them since they're all the way up in Vermont, and I think Vermont, don't get me wrong, or don't beat me up if I get that wrong, but I think it's Vermont. Anyways, they asked me to go sit in and read on their behalf, and of course I was happy to. So I went up there, and it was a nice meeting. Everyone who was up there was press up there and all sorts of good people, and a lot of people. It was really heartwarming to see so many people that were activists for the LGBTQ community. And I wasn't sure what to expect, to see if there was going to be a lot of contrast between the two parties, because there were some people there that didn't want the LGBTQ proclamation passed, but hopefully it does. I really do. Everybody that I talked to and spoke to today was really, really nice, and it was a really, really good experience. So let's hope that passes. The clothes drive that we had last week was a total bust, and we did help a couple of people. We found 3 people on the side, but everybody was gone. I don't know what happened. I don't know why all the places that we went to, and normally in West Palm Beach, were all closed down. And I don't know if everybody moved to a new location or not, or what was going on. So my job this week is to find all the new locations, because either this weekend or next weekend we are going to try for round 2 of this up in West Palm Beach. So if you guys have any last minute clothes or donations, please feel free to donate at our GoFundMe, or go to Spirit Communities on our Facebook and contact either myself or Caleb. Caleb is the lead volunteer, and we will discuss how we're going to pick up the clothes. So it's never too late to donate. All right, guys. As always, we are coming live on Facebook, YouTube, Twitch. I think Twitch. Yes, Twitch, Periscope, and LinkedIn. And as always, they're going to have iHeart replays on iHeart, Pandora, Amazon now, Spotify, Stitchers, and iTunes. So as always, Caleb is live with your chatting. He will be on all the social medias live, and he will be chatting up all you guys. So excuse me for 1 second. I'm not used to wearing makeup, and I already got something in my eye, and I hope it really doesn't bother me throughout this cast, which is why I don't wear makeup. But all right, guys, let's get into tonight's show, because we got a lot of stuff to cover. We really do. We have a lot to cover. And last week we were talking about diabetes. We went into a little bit of about diabetes, and I'm just going to recap a little bit about diabetes 1, because I think we got into most of diabetes 1, and but I figured we'd go into that, and then we're going to get into some blood diseases. This is part 3. And as always, people, when we talk about herbs and supplements and everything, please just don't go and take what we say. Please, as always, this show is not to be instead of any therapy or any type of medical advice. Please talk to your medical profession before decide to go on or off medication. and talk to them. If there's something you are interested that we say, well, then go to your medical professional and talk to them and see what their recommendations are for you. Because there are some things sometimes that may disagree with medication that you're currently taking, or may disagree with you. So it's never okay to self-diagnose or self-medicate. Okay. So with that being said, let's get into diabetes. So as I said last week, 30.3 million Americans, that's 9.4% of Americans are affected with diabetes. 1 in 4 don't know that they have diabetes, and 1 in 4 over the age of 65 have diabetes. 90 to 95% of cases are type 2. And that's just way too much. That is way too much. So especially being type 2, because diabetes is basically, well, our blood glucose is too high. Blood glucose is our blood sugar, and that is our main source of energy from the food that we eat. Especially we have insulin, which is produced by the pancreas. It's a hormone produced by the pancreas, which helps glucose into the cells for energy. Glucagon, which is also a hormone, it helps insulin control and work with it so that it can help the blood sugar as well. Diabetes, especially diabetes type 2, is due to poor diet, poor health. Type 1 is usually, both diabetes is basically when the body does not make enough insulin. There's glucose that stays inside the body, and it can't reach the cells. So imagine that your cells you need the insulin, you need the glucagon in order to process the sugars so that it gets in properly. You don't have those things in your body. And imagine your whole body filling up with sugar and just sitting there. And that's basically what happens in diabetes. And so type 1 is simple. Type 1 is when you're born and you don't have insulin, when your body doesn't make it or doesn't make enough. And this is usually due to an autoimmune issue. The immune system is basically attacking and destroying the pancreas cells that make insulin. And this is usually found in young adults and children. And these people have to take insulin daily. And I've known a few people that have had type 1 diabetes, but as I stated earlier, 90 to 95% are type 2, and that's usually what we're dealing with in this country. So genetics is what Western medicine says, and as I say, especially in type 2 diabetes, I don't think so. This is my personal opinion from my education. I don't think that diabetes 1 or 2 is a genetic disorder. I think it is, as I said last time, parents. It's depending on what you're eating. Remember that the building blocks that you're giving your child especially the mom, while you're pregnant, is what you're going to whatever food you intake, that's the building blocks that you're going to give to your child. So if you're eating a lot of junk, if you're eating a lot of non-healthy foods, a lot of sugary, salty foods, and that what's going to end up happening is you're going to pass that on to your child, and the body says, hey, this is all I got to work with. And so your child builds the body the way it needs to, and then when the child is born, we have type 1 diabetes. I truly, in my heart, believe that, and hey, unless science comes out and proves me exactly wrong, which, hey, I'll say yes, I am, but no, in my opinion, it is passed down from the parents, and I don't believe it's genetic. But according to Western medicine, it's genetic. It is also, and they also do contribute. They're also starting to say now that it is somewhat due to parents' poor diet. They still are saying it's more genetic, but I'm really going with that poor diet. Also, it may be caused, they're thinking, by a virus, but they're really finding out now. This was an old theory that viruses may play a part, but now they're finding out that viruses really aren't playing a part in it. But yet again, there is still more research to come. So problems with diabetes obviously have heart disease, stroke, kidney problems, eye problems, dental, nerve problems, and even foot problems. And this is prevalent in diabetes too. A lot of times amputation of the foot in diabetes too, because everything starts falling apart. So solutions there's not really, according to Western medicine, there's not really a solution for type 1 or type 2 diabetes. And the good news is that you're listening to this show, and this is where you got to go out and do your research and everything like this. But one of the types of diets that does work, that has been shown scientifically that does work, and millions of people have done this this type of diet, is the raw food diet. And yes, I know that a lot of people are like, raw food, well that's horrible, I can't have anything cooked. Well, you got to learn to adapt to your body, because what the raw food diet is it's basically raw food. Some of it's lightly heated to maybe 110 degrees for like a minute or something. But it is basically raw food. You pick it, you no processing, no heating, no cooking, nothing. And you have to have someone who knows what they're doing. And that's why there's actually, I think there's a couple places across the country that specifically cater this diet to people with diabetes. And it's similar to a retreat, where you go to a retreat, you go to this place, you spend a month there or whatever, and they teach you how to eat food. They get you accustomed to eating the raw food diet. And it is a tough diet, because your body wants to crave those sugars and those sweets and everything, and it's very strict, and it's going to be hard at first. But it's been shown over and over that diabetes type 1 and type 2 are reversed with this diet. And there's millions of people who have gone through this and have done it. So in my opinion, and from what I've seen from scientific proof, the raw food diet is a way to is a solution for type 1 and especially type 2 diabetes. So you have to start eating healthier. You have to start eliminating those sugars. You have to allow the food that the earth gives us to reset our bodies, because we have destroyed it with all the garbage that especially the American diet. The American diet, especially barbecue and all that stuff, is really terrible. There's a lot of restaurants, and I was saying this the other day to somebody. I was like, it's sad that there's no healthy food, especially late at night, because sometimes I get hungry. There's not stuff in my refrigerator, and the only thing we have an option for is Taco Bell, McDonald's, Burger King. And great, yeah, that's nice that once in a while you grab a burrito from Taco Bell or something, but when that's all your options all the time. And then of course health food in our country is so outrageously expensive, it's not even funny. So I understand that sometimes it's a problem with people, but there are ways around that. As always, exercise helps keep blood sugar low. When you move the body, you consume energy, you allow that sugar, you allow all that stuff to be processed in your body, and you have to do it. Immunotherapy as well is when you're exposed to a small amount of a substance that you're allergic to. It trains the immune system to tolerate everything, and this really helps build our bodies to be able to handle different things, especially with type 1 diabetes. In type 1 diabetes, the immune system cells wrongly recognize and the insulin producing cells, and usually they recognize it as foreign or dangerous, and then they attack it, and that's what's really going on in the body. So we have to learn that these type of ideas are going on with the body, and we have to work with them in order for that. So the goal of immunotherapy is to interrupt the autoimmune system process, and by injecting molecules to make the immune system create new types of cells that stop the cells that destroy the pancreas, or the pancreas cells. So this is really, really beneficial, but again, science is really pushing towards new things. Stem cell therapy as well is one of those big ideas that I know that we've been talking about stem cell therapy for a long time, and a lot of people have a hard time trying to figure out what is the benefits of stem cell therapy. But mesenchymal stem cells, they say helps with damaged sites. So these secrete the growth factors or cytokines, and it improves and reverse type 1 diabetes, or they're saying that it may produce type 1. So let's get into the studies, because I know that we got type 2 diabetes. I want to go through type 2 diabetes, and then I want to be able to get in there. But there is a study that thinks that stem cell therapy may help increase insulin. And I really am a fan of stem cell therapy. We don't know too much about it. There's some really beneficial ideas to it, and there's not enough research, or at least that we're being taught. So who knows? For all we know, stem cells can cure everything. And the government's just holding back. But like I said, we don't know what's really going on. So type 2 diabetes is the most common type of diabetes, obviously, with being 90 to 95%. It is the same as type 1, but the body has a hard time regulating the insulin. And that is the big difference, because where type 1 doesn't produce the insulin doesn't keep up with the blood sugar. So that means you're consuming so much junk, so much sugar, that the body says, you know what, I can't keep up with this. I can't produce enough insulin to fix this out. And again, your whole body fills up with sugar, and it just sits there destroying everything. And some of the common symptoms of diabetes are frequent urination, especially throughout the day, or that constant urge. A lot of times, even if you don't have to go, you sometimes frequently feel like you're always having to go. You may go to the bathroom, and 15-20 minutes later you're like, oh, I have to go to the bathroom again. Then you go, and then it kind of repeats itself over and over. But even if you're not really going, you're very thirsty all the time. People with type 2 diabetes cannot get enough to drink, especially cold. They love to drink cold, because diabetes starts to make them feel really warm and hot, and cold beverages, a lot of ice, they love that. And as I've said before in other shows, drinking cold beverages, especially with ice, is the worst you could do for your body, especially your colon. We talked about colon issues in our last show. If you haven't listened to that show, please make sure you go to listen to the last shows, because we were talking all about colon issues. But yes, ice and very cold beverages will ruin the colon and ruin the stomach, because you are dropping the temperature so hard and injuring everything. And this is and you're also very hungry. No matter what you eat, you just can't seem to get enough, because the body's not intaking the proper food, and it's not moving the nutrients through to the cells anymore, because the cells aren't acting properly. So you're always tired. You start getting blurred vision. You have cuts and sores that won't heal. Remember when I said about the amputation? I had a friend whose father had an issue with his leg, and the skin just wouldn't heal anymore, and it just started eating itself away and just having big open wounds on the legs, and that's very dangerous and deadly, because you can catch infections. And he was supposed to get it amputated, but ended up passing away from diabetes. One day the caretaker went into his house, and she thought he was gone. She went into his room, and he's in there convulsing and just kind of out of it. You could tell, and she said in his eyes he wasn't there, but his body was still active, and the diabetes was literally killing him in his sleep as she was watching him. So by the time they called, he was gone. So that's how fast. I mean, this was over years, but diabetes can take over that quickly. So one in 10, that's 34.2 million Americans have type 2 diabetes, according to the CDC, and 1 in 3, that's 88 million Americans, are pre-diabetic. This is a huge issue, folks. Our diet is so horrible for us. It is like I said before, it is all the fried food, the processed. If you want to eat that is fine. That is your prerogative. That's the great thing about freedom of choice. However, though, you got to understand that that's what's going to happen to you. Nobody is free from that. Just because you hear one person who smokes all the time and doesn't get cancer, or one person who eats like anything and never gains weight, that doesn't mean for the other 34 million people or the other 50 million people, it doesn't happen. That is one person out of so many millions of people that don't have anything happen to. So the chances of you rolling the dice and being that one person is really, really improbable. So you have to start exercises, and as I said, start walking, start doing anything, move that body. If the lymph system doesn't get pumped, all that toxicity all those sugars, everything, the adipose tissue, everything doesn't get used as energy. It doesn't get pumped out. Your body doesn't flush it out, and you become a toxic cesspool of toxicity, I guess. And it is just a horrible way to live. I have watched my dad and my family and so many people I've known with type 2 diabetes go down, and their quality of life is horrible. So as Western medicine said, they think it's genetic. It is not genetic, and I stand strongly for this because I have watched personally the same families, even in my family, and I'm glad I didn't like the same food as my family because we grew up in a Hispanic household. There was a lot of Mexican food and really good stuff, but I'm glad that I recognized the pattern because I was watching the same patterns passed down from generation to generation, eating the same food, and everybody having the same health issues. And no matter what family I saw this in, it was the same thing. I said, well, how did your grandparents eat? Oh, well, they ate this food too. Well, how did your parents eat? Well, they ate this food too. How do you eat? How do your children eat? Well, they eat this food too. Everybody eats the same food being passed down over and over. And especially here in America with McDonald's and Burger King and all these fast foods and all this, even these restaurants with these high sodiums and the high junk food, everything, all processed food, it is killing us. And so, no, I don't believe it is genetics. Western medicine can say it's genetics, and I will fight this tooth and nail until there is solid proof that it is genetics. But no, it is. To me, I see the same patterns, and I see the same things going on all the time. So a hormone imbalance, sometimes they think that produced by the placenta, especially in late-stage pregnancies with women, they think that could possibly trigger it, but again, I am really against that. So, but I am mentioning it because it was part of the research that we were doing. As always, they say that again with type 1, they were saying hormonal disease like Cushing's syndrome, hyperthyroid, stuff like that, and many other diseases. With medication, let's take a minute for a second and look at the medication. Actually, you know what? Let's take a break because I'm over my break, and we'll be right back after these messages from I Am Evolution.
The human experience is changing, and consciousness is evolving into something higher than any of us could ever imagine. As we transform into more sentient beings, a new world of connected consciousness is taking place. Welcome to I Am Evolution, the movement in human development that transforms the human experience into a deeper consciousness through perspective and duality. Are you ready to be a part of the next stage in human evolution? Call I Am Evolution today to schedule your appointment at 561-318-0006. That's 561-318-0006. Or email us at iamevolution@protonmail.com.
All right, everybody, we are back, and so let's get into the medications that because they are because a lot of things that are prescribed or they say that have medications that affect type 2 diabetes, they're saying niacin, diuretics, but diuretics are often prescribed for diabetes type 2. So anti-seizure medications are prescribed, psychiatric drugs, HIV drugs, and different things like that. So let me see. Hold on. My notes are all messed up here. They're going wonky on me for a little bit. But as I said, with the solutions, remember with medication and everything going on, you have to, this is why it's important to consult your doctor. And if you feel that the doctor is just totally just about medications, then go see someone else. Go see a naturopathic doctor, a homeopathic doctor, a doctor of Oriental medicine, and talk to them about different types of medications. Talk to them about different things you're taking, because some of these things might help, some of these things might hurt you, and that's really the gamble that you're taking. Especially, I will always profess that I'm against Western medicine medication like the pharmaceuticals. There is a time and place for Western medicine itself. But as far as healing the body, I think really, in my opinion, and from what I've seen throughout my studies and everything, which is why I went to Eastern medicine, it just seems like Eastern medicine has more of a grip and more of a hold on diseases than Western medicine. I don't believe in putting someone on medication their whole life and allowing them to suffer and just saying, oh well, that's just the way it goes, and there's nothing we can do for you. There are things. I truly know in my heart that the earth has provided everything that we need for us. So of course, everything starts with a healthy diet. I'm not going to get into that. Raw food, more exercise, losing weights, all that. Let's get into some herbs like ginseng, American ginseng. According to some studies, it may improve the blood sugar, the control of the blood sugar, especially fasting glucose, and increase insulin sensitivity as well. They recommend, and again, just because I'm saying this, remember, consult your doctors and everything. Don't just start taking things just because we say them. But what a lot of recommendations are, whether it's a powder, tea, capsule, whatever, is between 1 and 200 milligrams daily for 8 weeks, and that'll help a lot of the insulin. That'll help a lot of the blood sugar. American ginseng is amazing. Korean ginseng is for a little different thing. Just because it's ginseng, they have different properties. So just don't go out there and say, I want ginseng, pick out ginseng. Remember, consult your physician, consult your doctor, and work with them. Chromium is another supplement that a lot of people take, or vitamin, and it is for metabolism of carbohydrates and fat. It plays an important role in that area. And the one thing that I want to say about chromium, however, is a lot of people use it as a water pill, as a diuretic. And so if you're using a diuretic already, don't take chromium. Especially, this is why it's important for you to talk to your healthcare practitioner about this stuff, because you will end up hurting yourself even more if you're taking water pills because you have water around your heart or whatever. You're having these type of issues. Then you start taking chromium because you say, hey, I heard chromium works for carb and fat metabolism. Well, this is going to really throw you into a hard place. But for the normal recommendation is between 200, or is about 200 micrograms daily. With diabetes, it's up to 1,000 micrograms daily. And magnesium is another one where you take it, and it's 300 biochemical reactions in the body. It helps regulate blood sugar, and the recommendation is between 240 and 480 milligrams. And the recommended type of magnesium for diabetes is magnesium citrate. So you always want to make sure that you're picking out, because I think there's like 6 different types of magnesium. This is why it's so important to have knowledge and consult your doctors, because there's many different types out there. Cinnamon. Everyone has cinnamon. Everyone loves cinnamon. Cinnamon helps with blood sugar. It helps lower, not only warms the stomach and helps with digestion and and even colds. A lot of times that's why cinnamon is so delicious, especially in the wintertime for you people up north. I know it's getting cold out. Florida, it's still hot. I was still sweating going outside. But in up north, cinnamon is wonderful, and it tastes great on anything that you put it in or on. But it helps lower blood sugar, and the recommended is 1 to 3 grams daily. That's a lot of cinnamon. And don't do that cinnamon challenge anymore. I see so many people that used to do the cinnamon challenge and cough, and I was like, oh, that would be so horrible. I don't know why people do that, but yes, 1 to 3 grams daily. And and cinnamon is such a wonderful taste. As we talked about so many times, aloe vera, not only for the stomach and the hair and the skin and everything, aloe vera just seems to be a one-stop shop as far as everything. And it has phytoestrogen compounds which reduce blood sugar, especially the AC1 ones. And the recommended dosage is about 300 milligrams capsule every 12 hours. And then, so we also have gymnemia, which can lower blood sugar, especially when it makes food taste less sweet. I believe I saw someone putting a little bit on their tongue, which they said it tasted really horrible or sour. And then they went to bite something, and it kind of made the person not want to eat sweets. So Again, work with your doctor. Don't go out, buy it, put some on your tongue just to test it. But I've seen those tests many times, and that's one of the things. But it's a great antioxidant. It prevents organ damage, and the recommended dosage is between 200 and 400 milligrams daily. But they recommend don't take it with insulin, and talk to your doctor. This is one of those that you have to talk to your doctor. Coenzyme Q10 is a wonderful supplement as well. It is needed for blood sugar metabolism. If you're not taking enough, and you're not eating healthy, and you're not getting it through natural sources, well, then start taking the liquid for CoQ10, especially. There's two different types, and I'll get into that in a little bit. But you need that for blood sugar metabolism. And a study said that the first trial that they did, the blood sugar fell in 31% of people taking 120 milligrams. So that is huge for people that are struggling. And see, this is why I say that life, the earth, gives so much of what we really need to do this, because there's a lot of unanswered questions that will keep you alive with pharmaceuticals. But the earth really does help in so many ways, and there's a lot of plants, and this is why education is so important. But most doctors recommend CoQ10 with 50 milligrams because it protects the effects, especially with the depletion of diabetes. So hibiscus is wonderful. It has a wonderful taste. I love hibiscus tea. It is a traditional remedy in India, and it may help, the studies show, with diabetes, especially with ferulic acid. It's where it's extracted from the leaves, and it restores the cells for insulin sensitivity, which is important for the body because it has to be able to process that sugar and use it for what it is. But hibiscus leaves are Ayurvedic and treats things like swelling, skin infections, hair loss, and even graying. Yeah, I know. I'm going gray up here a little bit too much. And we're starting to see all those gray hairs. So maybe I need to up my hibiscus. But they're recommending 1.5 teaspoons of dry leaf up to 1 to 3 times daily. So, all right, guys, let's slow it down a little bit because I really wanted to get through diabetes because I know we were supposed to get through it last time. I know there's a lot of information. As always, I know this is a lot for you guys. I really do. And I understand that you're not going to understand it, but that's why I always make sure that you guys have the recordings and so that you can watch it again and again, because there's a lot of information, especially with these medical, with the alternative medicine shows that we do. It can be overwhelming, especially even if you have the disorders and you're trying to get more information. A lot of this should be like, you could be, but it helps a lot of times to write things down and get what you can. Don't feel overwhelmed. And like I said, just go over the shows over and over again until you get what you need to. And then again, do your research, talk to your doctors, and really try to get as much information as you can on your own, because as you do research, you learn. And just don't go on Google, look at the first thing that pops up, because a lot of those websites are paid. They pay Google to be at the top and might not necessarily be in your best interest to get the proper medical information. So that's why it's always good to research on where the medical information is coming from as well. So, all right, let's talk about anemia and chronic kidney disorder. Anemia is when the body has fewer red blood cells than normal. So that means the body is not producing enough red blood cells in the body, and we become anemic. And yes, our body shows. If you've ever been anemic, you have pale face, pale lips, pale tongue. You just feel weak and your mind is kind of out of it. You feel very foggy, disconnected. You have a lot of lapses in memory. There's so many things that go with anemia. You're having the proper blood flow and proper RBC count and everything is so vital to our health, because red blood cells, well, they carry oxygen to the organs and tissues, and that is what provides our energy from food. So when the spleen processes everything and transforms it into into the energy that we need and sends it out through the bloodstream, and it carries along on those little red blood cells to our organs and tissues. Well, if there's no taxis to drive us around anywhere, no cars to drive us around, we can't get to our destination. And unfortunately, this is what's going on. And the diet that we're eating a lot of times doesn't allow us to produce red blood cells. It doesn't give us the iron and all the stuff that we need in order to produce red blood cells, and our body lacks. And our bodies, we may be able to eat all the junk food and all the candy when we're young, but eventually that's going to run out, and it's going to use our kidney chi up, and then all of a sudden one day it's going to hit us. We're going to gain weight. We're going to wake up tired one day. We're going to ache. We're going to look at ourselves in the mirror. We're going to age quickly, and it's just going to fall apart. So we need to make sure that our red blood cell is good. So when you have anemia, basically with the red blood cells, it's also carrying less oxygen to the tissues and organ, especially the heart and the brain. So the brain and the heart are affected. And even in what I was going through this past 8 months, the first thing I did was produce more blood. So I started juicing heavily with the dark greens and the beets and things, and we're going to get into that in a little bit, but the things that really produce blood. And I was just making sure my body was full of fuel. And we were taking Chinese Chinese formulas, that herbs that produce all this stuff to get the body, because without the blood and without the red blood cells and everything, we can't get nutrients to our body. Hence, we're sick. So how is anemia related to chronic kidney disease? Well, basically anemia, it commonly occurs when people have chronic kidney disease. Basically, CKD is the permanent or partial loss of a kidney function. And they're finding out that anemia might begin when the kidneys are operating between 20 and 50% of normal function. So the minute the kidneys aren't processing, because remember, the kidneys filter blood as well and really recycle a lot of stuff and get rid of a lot of the toxic waste through our urine. When our kidneys aren't functioning properly, especially 20 to 50%, that's when a lot of our blood isn't being cycled through a lot, and we start to lack in blood. And anemia has been shown to worsen as chronic kidney disease worsens as well. So they're finding out that males from age 15, now remember, age 15 and above, that they should have hemoglobins, when they start having hemoglobins below 13 milligrams per deciliter, that's when they start seeing it. And females 15 age and above, below 12 grams. So you really have to start paying attention. It can affect anybody. Just because you're young and you're running around there, and if you're not giving your body the proper nutrients, you're going to start taxing your body. And yes, when we're young, we're able to beat ourselves up a little bit more. But this is why we're tanking out at the age of 30 and 40. If we were teaching our kids, and parents, I'm speaking to you, if we were teaching our kids how to eat healthy from a young age, we would not be starting to run out of energy at 30 and 40. We would not be going gray and gaining weight and being fatigued and memory loss and all these diseases at the age of 30 to 40 years old. It's too early for us. Start teaching your kids how to eat healthy at a young age. If they don't want to eat their dark green vegetables, well, then do something that makes it, at least if they're getting the dark green vegetables. I know my mom used to coat cheese on my broccoli and different things like that. And yes, I know cheese is dairy and it's really bad for us, but hey, at the same time, at least I was eating the broccoli. And you have to start doing it. And I don't mean just pour a whole pot of cheese just so your children will eat it, but they got to start learning to eat healthy from a young age so that we don't set them up for disease when we're older, because that is what's happened to many of us. And for some reason, we don't catch on to that. We just accept this as a normal part of life, and that's just not true. So the last two things that I want to mention before we take a break is dialysis. And dialysis is a horrible treatment that people with kidney disease have to go through. So there's hemodialysis, which is basically when you have to hook up to a machine and it circulates a person's blood through a filter outside. So it takes it out, puts it through a machine and then puts it back in your body. The other one is peritoneal, and that is using the lining of your abdomen to filter the blood through the body. And both are not comfortable. Both are, and basically you're tied to these machines the rest of your life. And it is very, very horrible to go through. And anyone who is on dialysis, I feel for you, because you know how hard it is having to go to this machine a couple times, 2-3 times a day to filter your blood. So, all right, guys, we'll be right back after these messages from I Am Evolution.
The human experience is changing, and consciousness is evolving into something higher than any of us could ever imagine. As we transform into more sentient beings, a new world of connected consciousness is taking place. Welcome to I Am Evolution, the movement in human development that transforms the human experience into a deeper consciousness through perspective and duality. Are you ready to be a part of the next stage in human evolution? Call I Am Evolution today to schedule your appointment at 561-318-0006. That's 561-318-0006. Or email us at iamevolution@protonmail.com.
All right, everybody, we are back. If you're just joining us, which I hope you've been joining us for the whole show, we are talking about chronic kidney disease right now. We were talking about diabetes, but right now that's where we're at. So what is the causes of chronic kidney disease? Well, it is a deficiency. It is necessary for red blood cells to produce hemoglobin, and the hemoglobin's main job is their oxygen carrying proteins, and they have to be able to do this in order for us to be healthy. So we are deficient in iron because we're not eating healthy. We are deficient in vitamin B12 and folic acid. Those are the major 3 vitamins that we're usually deficient in. That's why it is so important to eat your dark green vegetables, or juice them, or eat fruits and vegetables that produce iron and vitamin B12. There's a lot of people that hate to go on a vegetarian diet because they say, oh, well, I'm not going to get my vitamin B12 except for so I need it by meat or whatever. And what ends up happening is you end up gaining chlorella. Chlorella is a wonderful supplement. So there's always something plant-based that is able to get your vitamins in. And so this whole mindset of I need meat, I need junk, I need certain things is only in your mind because we don't have the education to be able to get it. But those are the 3 that are lacking. Some other issues why we have low red blood cells count leading us to some chronic diseases. Well, bone marrow. We may have bone marrow issues, and especially inflammation diseases like lupus, arthritis, as we talked about last week, IBD, as well as diabetic ulcers, and of course malnutrition if we're not getting the proper nutrition, or if our body is not absorbing the nutrition properly. So that is the thing. So when we have kidney disease, chronic kidney disease, we start feeling weak. Remember that we have a lack of blood. We have a lack of blood flow and a lack of red blood cells. So we remember we get pale, we feel weak, we feel fatigued and tired. We get headaches because remember the blood has to reach our brain, and a lot of times when we get headaches, people are like, oh, well, that could be a sign of blood deficiency. That's one of the causes that happens. Usually headaches are from a deficiency. Of course, it could be from an excess. But in this day and age, especially with America and our diet, no, I would bet it's from a deficiency, and most likely a blood deficiency. And so of course, like I said, when we're deficient in blood, our brain needs blood in order to work properly. So if our brain is not getting the proper blood, well, then we have concentration issues because we can't concentrate. And like I said, then you get pale, you get dizzy, you have breathing issues. That's the reason why even I started having breathing issues when I had those complications with my heart. Excuse me, because I wasn't getting the blood flow to where it needed to be, and so my organs were lacking. And now that things are starting to get back to normal, I'm starting to be able to have these things. They're still having rough times, but I'm starting to notice a change because my body is full of blood. And that, so irregular heartbeat, hey, that's a lot of times we just think it's anxiety or it's cortisol or it's our adrenals going nuts, and maybe our HPA axis that's off, and that's what's going off. But it could be a blood issue. Blood has a lot to do with a lot of things in our body, a lot of complications in our body. So heart enlargements as well, that could be another thing. And heart failure, of course. If the blood has nothing to pump, guess what happens? If there's not enough blood flow going to the heart to contract those muscles and everything like that and give it the nutrients it needs, well, then we have heart failure. So a lot of times we overlook blood. That's one of the things that's the most often looked, it seems like, in at least in people's mind. In the hospitals, that's one thing that I'll give Western medicine credit for, is the first thing that they do is draw blood and check the blood and everything, because a blood test will definitely tell about the RBC count, and that's one of the great things that's why one of the reasons why I will go see a Western medicine doctor and get my blood, because a lot of times I need to know what my levels are, my hormones, my white blood cells, my red blood cells, and all the other lists. I know it's a sheet this long, sometimes 2-3 pages, but you know, that you want those levels, you want to understand, because yes, sometimes if you're in those areas and just a little high or low, forget about them, don't stress. Even if it says oh high or oh low, if you're within like 10 to maybe 20 off, you're still okay. But once you start jumping up to like 50, 60 below, or 100 above, 100 below, that's when we start having really big problems. So if you ever have a test and it's just a little bit high, don't fret, don't stress yourself out about it. It might be normal for your body. And so Western medicine, how do we treat chronic kidney disorder? Well, first thing, what did I talk about? Well, we raise our iron levels. Yes, iron is major in helping produce blood and helping the body. And so we have to eat our fruits and vegetables and take supplements. A lot of times Western medicine will put you on supplements. And yes, I know iron sometimes gives you constipation. So what you have to end up doing is maybe take a gentle iron or taking smaller dosages and build yourself up. But again, you're going to be talking to and working with a healthcare professional to be able to properly do this. And then this word I have butchered all day long. I have been dreading this word because no matter how many times I say it, I always butcher it. But it's erythropoietin, and these are injections, GMO injections, and these a lot of times will be offered for chronic kidney disease, and these have been a serious health risk. People have had heart attacks, strokes, some serious health issues after doing these injections. Again, talk to your doctor, but when I start seeing the data that's coming back and what the side effects are, and people are having, and it's not just one here and there, but when I'm starting to see a list of people having these things, those are things to stay away. And of course it says GMO, it's genetically modified. So that means that we kind of need to stay away from GMO, because our bodies are not made to take genetically modified things. And we will find that out. Even if you're for GMO, when we are old, we're going to find out. Just like our parents found out that microwaving food and cooking with aluminum and all that stuff, they're all finding out how they caught diabetes and cancer, how that generation's full of cancer, because they didn't know now. That's the same thing that we're going to find out with GMO later. So of course, RBC transfusion, red blood cells, and that vitamin B12 and folic acid supplements, obviously, and of course nutrition as well. So natural ways, as again I mentioned those supplements, but also some very key things in chronic kidney disease is vitamin D. Vitamin E, selenium. Vitamin E and selenium go hand in hand. You always should pair those two. And omega-3s. Omega-3s are so wonderful for our body. Dark green vegetables like your kale, your chard, your spinach, arugula, your beets, your fish, because hey, it has the omega-3s. And a lot of these foods have the above vitamins and supplements in it. So olive oil is great for that as well. Garlic, berries, and the list goes on. But I just want to mention a few. So let's talk about a couple herbs, because I know we only got 10 minutes and I really want to talk about this. And then I think we'll stop there, because I know we were supposed to go into sickle cell disease, but I don't think to talk about it for a minute or two is really doesn't seem proper. So let's talk about some herbs for the last 5 minutes, because herbs are very important. As I say, Mother Nature gives us everything that we could offer. And so alfalfa is great. If you've never had alfalfa, there's many stores. And again, you need to work with your Western medicine doctors are probably not going to know this stuff. So if you go and say, hey, I heard alfalfa and dandelion work wonders on chronic, they might know, because some of the doctors are having to take CEUs for alternative medicine now, because a lot of people are pushing that way. But if you have a doctor that says, I don't know what that is, then that's why it's just so important to go see like a doctor of Oriental medicine, which is a Chinese doctor, or a naturopathic doctor, or someone that works with herbs, because these herbs and the combination of the herbs can really be beneficial to you. But alfalfa, it's high in vitamin C and vitamin A, and it promotes the absorption of iron-rich foods. So if you're taking things that you need iron, such as kale and chard and spinach and things with high amounts of iron, well, then you want to take something that's going to make sure that you absorb all that iron-rich food right into that bloodstream, because that's what you really want. You want the most bang for your buck, and alfalfa is definitely one of those herbs. This next one is funny, because if you come from up north, you know when I say dandelion, and you think right away, you think of the weed with the yellow head or the white head, and you either blow off all the stems making a wish, or you pop off the head and smear it or color your skin and you turn yourself all yellow. But dandelion is not a weed, people. It is it is one of the most healthiest plants in the world. And it is prescribed. A lot of doctors prescribe dandelion, especially when someone's having a hard time surviving in life. And I mean physically. I started taking dandelion when I was on the ropes of, is my heart going to give out? Is my body going to give up? I started drinking dandelion, because dandelion is huge in iron. And again, you can't be drinking gallons of this, because dandelion is very strong, and you got to know when to cycle it in and out. So you really got to do your research. Just because they sell it at Whole Foods doesn't mean everything is safe. A lot of over-the-counter supplements, a lot of over-the-counter teas and stuff, yes, in small dosages or small quantities, yes, is safe, because they wouldn't sell, but it could still be very deadly or dangerous. It could cause health problems. Not deadly. But it's high in keratin, even more than carrots. So we think about all the time, we need these keratins, we need these, and we got to eat lots of carrots. And I love juicing carrots. Nothing tastes greater than fresh carrot juice. But this is huge. It's not only iron rich, but it has more keratin than carrots. And it's also high in potassium. You need potassium for your kidneys to function properly. All of these things that I'm mentioning right now are high in potassium. So you just don't think of bananas when you think, oh, I'm going to eat a banana because it's high in potassium. There are a lot of other things besides bananas that are high in potassium that will help with kidneys. And I think actually, bananas might be actually kind of yellow flagged when it comes to kidney disease. I'm not sure. So American ginseng, we're back to American ginseng, as we were talking about in diabetes. It's high in potassium, high in phosphorus as well. Phosphorus is an amazing, but I gotta mention a caution with American ginseng, especially if you're pregnant. Pregnant pregnant women, you have to be cautious with American ginseng and that, because it could cause complications. And as well, remember when I said with diabetes and insulin, so you got to be cautious with that. But if you're not pregnant and you don't have diabetes and you consult your doctor, well, American ginseng is definitely going to help out. Bitter melon is high in potassium and phosphorus as well. What makes bitter melon so great is it works on so many levels. It is anti-inflammatory, antifungal. It is also antibiotic. It's a natural antibiotic. And there's so many plants out there that are natural antibiotics, and that's the reason why I'm so against regular antibiotics. Hey, sometimes if you have a severe acute infection and you really need a bang for your buck, hey, great, go to Western medicine, take some of those hardcore pills. It'll kill it right away. But it also does a lot of damage to your body. There are a lot of things that you can take and eat throughout the weeks and just constantly have in your diet that act as a natural antibiotic, antifungal, and you won't have yeast problems, you won't have infection problems, you won't have so many of these things. And this is why proper nutrition, you just don't think of salads all the time. There's so many things in this world that we have to start incorporating, especially for an Americans. We have to start educating ourselves and our children to start learning what these plants are. And they're antiviral as well and anti-parasitic. Oh my God, we are so loaded. One of the things that I've noticed with disease is that if you have disease, you usually have parasites. And yes, we all have parasites in some ways, but usually we have an abundance, or we have a different parasite that really wreaks havoc in our body. And there's some great doctors out there that have written some great books about having most diseases like cancer and things leading from parasites. And so you could be taking bitter melon and some of these plants and drinking teas and throughout your day and really giving your body the best chance it can and really keeping things that'll cause disease. But it's also a blood purifier. And again, our kidneys, if we're having problems purifying the blood and extracting all the toxins from our diet and smoking and chemicals that we inhale, this is a great thing to help our blood be pure. Japanese honeysuckle as well is another one. And lemongrass. Lemongrass is wonderful. A lot of you love the taste of lemongrass tea and different things, but it increases packed cell volume count, and it also increases hemoglobin, which is huge. Papaya is another one. And again, if you talk to your Chinese doctor, there's formulas like Marrow Plus out there that I took to help me really, but again, you got to be cautious because if it's too much putting in the body. But there are so many Chinese formulas out there that'll help, and this is really why I went to Chinese and Eastern medicine. And it may sound like I'm a little biased, guys, but I really try to take the whole perspective. I don't believe that Chinese medicine cures everything. I don't believe Western medicine cures everything. I don't believe Western medicine is all bad. I don't believe Eastern medicine is all. So you have to have the full spectrum. You have to have the full perspective of everything and really understand the strengths that everything has. And that's what makes health perfect. One of the things I want to mention really quick, because I know it's time to go, is there's a few herbs that you have to avoid. And I won't get into it today. Maybe next week I'll tell you why, or if you guys email me. But the few things that you have to avoid if you have chronic kidney disease is astragalus, cat's claw, creatine. I know a lot of you people, especially you weightlifters and you people that go to the gym, use creatine. Creatine is not the best supplement for a lot of bodies and can create a lot of kidney issues. Goldenrod, licorice root. I know licorice root is very healthy in many areas, but if you have chronic kidney disease, you don't want to be taking licorice root. And stinging nettle. Stinging nettle as well. And I know there's a lot of products with stinging nettles, but this is eating. We don't want to take that. So, all right, guys, that is tonight's show. Hopefully I got through everything. Again, talk to your medical professional. I know I sound like a broken record, but it is so important for you guys to understand that. It really is. I know sometimes you can't afford it, or you just want a quick fix. There are no fixes. Hey, I've dealt with this for 8 months, 8.5 months. I want to get back out there going to the gym, but I also know I have to take care of my body. I have to revamp everything. I have to really feed my body what it needs in order to become healthy again. And it takes time. So remember, it took time for you to get sick. It's going to take time for you to get healthy. So you have to have compassion and understanding with yourself in that sense, so that you can understand that the body needs to heal itself on its own. And these are just some of the ways it can. So, all right, guys, that is it for today's show. I can't find my board. I don't know why my board is gone. But yes, I found my board. I should have it out, shouldn't I, before I do the show? But all right, guys, make sure you follow us on our Facebook at facebook.com/Transcendental Transformation. YouTube is Transcendental Transformation Radio Show. Visit my website, soulandspiritguide.com. Make sure you sign up for the newsletter to receive hidden shows and VIP access to the website and special guest offers. And if you have any questions about this show or any previous show, please, guys, I always love hearing you. Email us at transcendentaltransformations@gmail.com. And always remember to believe in yourself. And it's not our abilities or our talents that make us who we are, but it is our choices. Thank you and have a wonderful evening.